Mr. Duron to present his amazing experience about being an EMT worker and also as a software engineer.
Hello, can you hear me? No? No. Hello?
Hi, we can hear you.
You can?
Thanks for
Excellent.
coming in.
Thank you guys so much for hosting this. I just want to say an organization like this is a great entry point for people all ages. Myself, I was inspired at the young age of 15 and 16 years old to join my local fire department and serve my community. Let me see if I could share my screen here. You guys able to pass me those permissions? Present, here we go, yep. All right, here. And, oh, wow. All right, so this is me. Again, I'm David Duron. In the center, that's what I look like now, and on the left is 16-year-old me, who had no idea the path in front of them. Again, I started at 16 years old. It's a great way to get involved in the community is serving others, especially in the healthcare industry. We have people here with a lot of experience, a lot of coding experience, some none at all. And it doesn't matter your experience, you have a unique perspective that will allow you to solve one of the million healthcare problems we have now. My work ethic and experiences as a young firefighter EMT paved the way for my problem-solving abilities. As I got older, I wanted to change the world. And like I said, there are a ton of improvements. Our entire purpose in life is to inspire others, save the world, and change lives. That's what we're here doing today. Each and every one of you individually and maybe even as a team are going to go on and do things later in life that makes this project look small. But don't ever forget that it's not the project that makes a difference. It's your individuality and unique perspectives that makes a difference. You will inspire. The solutions that each team creates are needed. Doesn't matter if it's similar or not. There's a billion problems, and each team will come up with a unique way to solve it. Your project will not be for everybody, and that's fine. We're going to take a look at 3 prongs here that the healthcare industry faces. Top one is certified healthcare provider retention. Just on the EMT side, public safety, 70% of new certified providers don't last after 4 years. In the nursing side of things, in hospital side, that's getting worse, especially during COVID. After COVID, all the extra money's gone. Training programs, nobody really wants to come out here and help anymore. But those that do, we greatly appreciate them. As you guys know, to become a doctor, that's the path you need to start before you enter high school. You need good grades. It's highly selective. And unfortunately, as good as our healthcare system is and our training and everything, that leads to a lower amount of new physicians entering the healthcare industry. We have a population crisis. Everyone's getting older and needing medical care at this time. There's no changing that. It's happening. Third prong is getting paid by the government. How do hospitals and ambulances and helicopters, how do they all get paid? Our federal government pays it through insurances, Medicare, Medicaid, amazing programs that helps people from all walks of life, whether you're rich or poor. The healthcare industry is there to help people. Some of these things here, you'll realize that if a healthcare company will use your software, it's because you're going to meet all 3 prongs. And if you have a fellow teammate or opposing team who has a similar program, again, your unique perspectives and experiences and your problem-solving ability separates you. It places you apart. You could have 2 very similar products, and it doesn't meet all 3 of these, or you present it in a different way, or it solves a problem very slightly different. That makes a huge difference. It's the small details that make a difference. You could have a project where you allow a physician or a nurse to spend their last seconds of a patient's life in their care holding their hands, giving comfort, rather than them being in a separate room on the computer trying to solve a report because their hospital has to get paid. Small stuff like that, it makes a huge difference in everyone's lives, and the families that are going to remember you, the providers are going to feel better. It's always tough to say, hey, I should have done a different avenue of treatment, but I had to get my report done, and the patient may have suffered because of doing so. So these solutions may make small impacts once again, or they may make a huge granular impact where you're affecting like the operations of a hospital or an ambulance service or whichever. And that's okay. Just pick a problem, commit to it, and put every bit of your effort into it. Because you know, these doctors and nurses and EMTs, we're spending anywhere from 16 to 32 hours without a break or even a small break, 5 minutes here and there. And our patients deserve every bit of our passion and our treatment that we can provide. It doesn't matter if we're tired, we're giving 100%. And that's what you guys need to do. And I know you will, because you're here. Again, we all want to make a difference. We want to put our best foot forward without hesitation. So if you guys review all the judging criteria, bring this over here, you'll actually see what we just talked about of the impact of your healthcare solution, the creativity, and all the stuff I just went over, how to make a difference. You guys all have it. Again, you want to be here if you didn't. Just by meeting the 3 challenges, you're going to have a winning product. And if you don't win, that's okay. There is a need for what you guys come up with, and it will be used. Our healthcare industry has a need for everything. So one thing I want to mention here, again, is close to my heart. I'll open the floor for questions if allowed. But to continue making a difference, your efforts don't end here. CSYA has a great way to reach people of all ages, including the youth, and that's really the future of our country. So we'll continue working with this organization. If you're willing and have some free time, want to see how you can impact in the future, you're always welcome to volunteer to your local hospital or a fire department. Doing paperwork, your city or county may not have these programs, but there are ways to get involved with your community. And thirdly, if you guys are confident and see the marketability in your project, go ahead and advertise them. Start getting the ball rolling, because once you do that, you'll get market feedback. Once you get market feedback, your product's going to be good, and you're going to know exactly how to sell. And then next thing you know, you're actually making a difference 100%, and you're going to inspire others. That's all we're here to do, is inspire, whether it's our patients, whether it's each other, or the people who come after us. I'm looking forward to everything. I'll take questions if you guys want to post in the chat.
Mr. Duron, you're muted.
Thank you, Mr. Chung.
Yeah.
Mr. Ewan says, do you think burnout and workplace exhaustion is a widespread problem in our healthcare system? Absolutely, yes. Just go on Reddit or anywhere on social media, you'll see doctors, especially new physicians, they're saying, you know, I spend 30 hours or 28 hours on the clock with a 5-minute nap here and there. How am I supposed to accurately provide treatment? On the pre-hospital side, there's been times where I've been at work for 16 hours and my relief didn't show up, so I had to work an additional 16-hour shift. These things happen. Our nurses, especially during COVID, there was a great social media effort to say, we need help. So if you look at that, we're not able to say, hey, I need my lunch break, because our patients need us. Hope that provides some insight. Mr. Johnny Shen says, which areas of CS do you focus on daily? For work, can you describe a bit more of your involvement on software side of healthcare? Thanks. Yes, sir, Mr. Shen. So right now I'm working on, it's called Cytopia Social Network. It's along the same veins of the old Gaia Online, Neopets, like build your own avatar, connect with others. It's actually geared towards the youth side of things, which would be a great aspect for CSYA if you guys want to talk about that later. When I first got involved with this, I had a goal in mind, and that goal was to allow pre-hospital providers to see the medical charts that the doctors have. Because a lot of times these patients don't really know what kind of ailments they have. They don't understand why they're taking certain medications, or sometimes they don't even know if they're taking the medication, to be honest with you. And by eliminating that doubt, a pre-hospital provider can provide personalized treatment from the point of dispatch and all the way to the emergency department and follow-on care. That project was actually with Curved Arrow Networks. It's halted at this time, but there have been some talks with the previous company about getting that started back again. That was around 2019 when stuff like FHIR, FHIR, and healthcare interoperability were still new. Now it's evolved a little more. It makes a little more sense, and it's easier to implement. And so going forward, that's definitely on the table. For those of you in here, ask anything, even if it's not relevant to my experience. We're here to help. We're here to inspire. We're here to help you accomplish your best goal. And overall, that's why we're here. So let us know. Mr. Zhang, how can I help you, sir?
Yeah. So can you tell me about how your ability to deal with stress has helped you in your career transfer?
Absolutely. If I didn't have a stress story, you probably wouldn't be able to have me here. Stress, there's different types of stress. There's youth stress, where it's a positive stress. You're mentally and physically able to handle that stress and take it and output a desired result or positive result. Actual stress that we know of is like depression stress. Forgive me if I don't remember the terminology. It's been quite some time since I've been in the medical field. But here we go. There's two different types of stress, positive and negative. And just by having to separate that and use type of stress, like on the ambulance, it was stress of making sure I treat the patient right according to local protocols, which is like a treatment plan predetermined by a doctor years in advance. Versus now in software, the most stress I worry about is implementing API right, or remembering to take a break, get a snack, get some coffee. But having the ability to separate a non-problem from a problem via stress is the most important thing. So, for example, if I'm working on a new project, or we'll use a new project, for example, and I have a million things to do. We all know, got to create a login system, registration, user interface, dashboard, yada, yada, yada. Okay, that's fine. We've done that a million times. But what's the most important thing that you got to take care of that you know will take the most time and have the most impact? Sometimes it's not going to be the same as having the most impact and taking the same amount of time. You got to decide personally what's the most important thing here. So if it's a time crunch, you got to work on that long project. You got to take care of that. Prioritize. Did that answer your question, Mrs. Zhang?
Yes, thank you.
You're welcome. Thanks so much for coming. Mr. or Mrs. Shaw had said, after identifying a modern healthcare problem, do you have any advice on how students can brainstorm potential solutions? Absolutely. And I don't know everything, but so far I do know the questions being asked. So I will let you know if I don't know something. So if you identify a modern healthcare problem, for example, 70% of newly trained, newly certified EMTs leave the job industry after 4 years. The first 4 years we're constantly learning stuff. You're new, so you're recertifying every 4 years. But lately, the National Registry of EMTs has said that we're taking a look and seeing 70% of people are not staying. Me, as a healthcare provider, with the experience I have seeing the different types, pre-hospital and in-hospital and follow-up hospital systems here, a lot of different ways to implement it. What you could see is different perspectives. And my perspective, I could say, okay, we eat our own. We tell everybody you got to work these 16-hour shifts. Burnout's a huge reason why people are leaving. Our hands are tied behind our back by following local treatment. Does that mean I think all EMTs and paramedics should create their own treatment plans and be on par with doctors? No, it does not. But I do think, and this is a personal passion opinion of mine, so forgive me. The healthcare industry that I've experienced with has not changed since its inception in the 1970s from the white paper created by the NHSTA, known as Accidental Death and Dying. It's a white paper creating the EMT system. So with that being said, there's a million things that would change. It's my unique perspective that allows me to say, let's change this, let's change that, let's not change this, or we should just leave this for now, make other changes, come back to it. So how students can brainstorm that is use your unique perspectives, your own experiences with yourself, a family member, what you see in the media. Because let's be honest with you, let's do a little industry secret. These problems with all these experts who have all these years in the healthcare system, software industries, these problems would not exist if these guys knew how to solve them. So if we're here, we have a fresh perspective. We know what we want to change. We see a huge problem, and your gears are turning. You might come up with the problem that you want to solve after a day of, being in the environment. It might take you a year. It might take you 10 years. It took me 10 years. But you're going to say, you know what? I got my gears turning. I have this problem. It's a huge problem. I know exactly how to solve it. And you, as a student, the best thing you can do is start getting it going. Because there's going to be obstacles. You're going to have school get in the way. You're going to have college get in the way if you go that route. You might have military if you go that route. There's going to be all these obstacles and delays that if you start now, by the time you're ready to this project, and you're going to know, you're going to be like, maybe it's ready to release, maybe it's not. But you're going to know in your heart that you have a working project, that a solution that you can solve and only you. And you're going to know. So by brainstorming, just putting yourself in an environment, observe, see what these old people are saying. We've always inventoried our healthcare bags a certain way. Okay, why do we do it that way? Why? I asked a million questions when I was a firefighter, and especially a million more turning into the software engineering industry. Don't stop asking questions. Make sure you have a clear understanding why everything is being done a certain way. And if you see a problem with it, speak up. Write it down. Solve that problem. Make yourself be the change you want to see. That's it. You can do it. Each and every one of you guys can do it. That's what's great about these things. Everyone, I know people are there, they want to ask questions, but they're too shy, which is fine. I would have been shy if I was coming to these things, but it's great. Being shy is good. You need to be scared because you know you could accomplish a huge thing. You can do it. Mr. Shen says, what do you like to do for fun outside of your work and health-related topics? I really like to lift weights. It's become a new hobby of mine. Cooking, I really like to cook. If I wasn't doing the software thing, everyone tells me I shouldn't be a cook. But you got to do what you're good at and what you enjoy. Outside of work and health-related topics, I am on Xbox. I played competitive esports during the pandemic, but that's that's no longer. I just play casually now. Because like you guys, I'm all involved in my projects. I want to do my projects, and I'm going to make a difference. I make a difference every day by continuing to work. Thanks, Mr. Chen. Mr. Emmanuel, thanks for joining. We're taking questions or in reference to whatever you want to ask.
Okay, thank you so much. Yeah, I was looking into the medical field recently, and I guess I'm just exploring right now. So, yeah, it was great. Your talk was great. Thank you so much.
You're welcome. And that curiosity, it's a calling. So you could go 10 years on a different journey, and you're always going to have that itch. I talk a lot about the EMTs leaving after 4 years. The same studies show that after 2 certification cycles, so anywhere from 5 to 8 years, EMTs come back. So according to statistics, I should be back soon, but I don't plan on it. It's a calling. If it's your passion and you're called to do the service in any capacity, you're going to be there.
Right.
All right. There's only a few of us left here. If no one else has any questions, I'm going to turn it over to the lovely staff for CSYA. Again, you guys have a great opportunity ahead of you to change the world, and it starts today. So good luck to everyone, and we'll look forward to seeing what you come up with. Thank you.